morning everyone. I am Rachel, Assistant Professor from the Department of Pharmaceutical Technology. From the Medicinal Chemistry subject, we are going to see about the drugs acting on the cardiovascular system. What is meant by the drugs acting on the cardiovascular system means they will work by blocking the effects of particular hormone that is effectively acting in the cardiovascular system of human body, which will slow down your heartbeat and improves the blood flow. Examples of the drugs acting on the cardiovascular systems include beta blockers or beta adrenergic blocking agents, calcium channel blockers, diuretics, vasodilators and digoxins. Calcium channel blockers. Calcium channel blockers are nothing but the medicines which is used for the treatment of lowering the blood pressure. By stopping the enter of calcium from outside of the cell to inner side of the cell, that is from the exotic and into the endocytosis of the cell, the calcium channel blockers will act. They stop the calcium from entering the cells of the heart and arteries, not only in the heart and arteries but also in some specific cells. The calcium channel blockers are used. The calcium causes the heart and arteries to squeeze more strongly by blocking the calciums and also to allow the blood vessels to relax and open. The calcium channel blockers are available in mainly two forms, short acting and long acting. The difference between the short acting and long acting is the effectiveness. The short acting may affect only for few hours and the long acting will be of sustained release and provide a long lasting effect. The diagram will effectively show the transfer and blockage of the calcium from the outside to inner side of the heart cells. The examples of calcium channel blockers are listed below. These examples and these are the drugs prescribed by our doctors for the effective treatment of calcium channel blocking agents that is used in day-to-day life. They include Norvasc, that is nothing but the amlodipine, and Cardizem, Tizap, and then Felodipine, Isradipine, Nicardipine, and then Procardia, Sular and Brilin. The Sular and Procardia are prescribed by our Indian government and then by the British government also. Uses of CCB include it is used for the treatment of coronary artery disease, which is nothing but the heart failure or heart disease, and chest pain called angina, and then irregular heartbeats called arrhythmia, and blood vessel contractile conditions such as Raynaud's disease. Specifically considering for the black people, calcium channel blockers might work better than the other blood pressure medicines. Such as other blood pressure medicines include the beta blockers, angiotensin ACT converting enzyme blockers inhibitors, and angiotensin receptor blockers, which will be seen in the consecutive slides. The side effects, obviously, if we are taking any medicine that is for the heart disease, there will be some side effects in the human body, which include the constipation, dizziness, and then the arrhythmia, that is increased heartbeat level, extreme tiredness because of the blockage of calcium, and then flushing, which is nothing but the hallucination, and headaches, nausea, swelling in the feet and lower legs, which is caused by the high blood pressure in the veins of the legs. The mechanism of action of calcium channel blockers is is depicted in this picture, which is nothing but it will block the calcium channels present in the cell wall of the heart muscles, which will inhibit the transfer of calcium from outside to inside of the cell, which results in the muscle contraction. This is the mechanism of action of calcium channel blocker tablets. Synthesis. We are going to see one synthesis of calcium channel blocker, Felodipine, which is a more common and currently used drug for treating the cardiovascular diseases in India and British government. The precursor molecule for synthesis of Felodipine starts with 2,3-dichloro-benzoaldehyde combined with ethyl acetoacetate results in ethyl 2-acetyl 3,2,3-dichlorophenyl 2-propionate. on combination with the methyl 3-amino-2-butanoate, in the condensation reaction, it will result in the phenolipine. In the condensation reaction, one molecule of water will get evaporated. Vasodilators. In the classes of drugs acting on the calcium channel block, drugs acting on the cardiovascular system, vasodilators play a main role, which is used for the dilation of the blocked blood vessels, especially by the fat tissues, fat cells. Vasodilators keep your arteries and veins away from narrowing or contracting, that is nothing but the squeezing down of the arteries or veins. We have only two types of blood vessels, that is veins and arteries. Veins will carry the blood to our hearts, and then the arteries will carry the blood from the heart to the rest of our body. This is we know. When there is any blockage or some kind of squeezing reactions happen, the vasodilators help in the dilation, that is the opening of the blood vessels. We are taking the vasodilators as prescribed medicine. Mechanism of action of different kinds of vasodilators. Based on the vasodilator, the mechanism of vasodilators change. For example, if we are going to take histamine compounds or acetylcholine, the release of nitric oxide from the prescribed histamine or endothelium is the main mechanism. When we are taking phenolidopam as a vasodilators for treatment of disease, activation of dopamine receptors is the main mechanism in the neuronal regions of our brain. The classification of vasodilators. Vasodilators are antihypertensive drugs, as we all know. This is mainly classified into two types, calcium channel blockers and vasodilators. The calcium channel blockers, as we have mentioned earlier, it is again classified into three types based on the side chains we are designing. That is, first type is phenyl acrylamine, and then the benzothiazepine, and then the dichloropyridines. In the calcium channel blockers, the dichloropyridines play a main role in treatment of heart-related diseases because of its high demand and high production units. And comparing to the vasodilators, the digitasm from the calcium channel blockers have a great potential. And then coming to the vasodilators, the atriolar, it is classified into the atriolar dilator and then the atriolar venodilator. That is nothing but based on the arteries and based on the veins. How the vasodilation takes place, we all know, by enhancing or enlarging the arteries and veins. Based on that, the side chains of the drugs are designed. These include the hydrolazine and then digoxide and then nitroprusside SOD. Synthesis of hydrolazine, that is the vasodilators. The precursor of the hydrolazine comes from 2-formyl benzoic acid. The side chains acts with the NH2 bonds and then result in the hydrolazine of vasodilators. The main action of shifting of the side chains happen results in the hydrolazine in the geometric form. Then the anti-anginal drugs. The anti-anginal drugs, the main mechanism is it will inhibit the flow of calcium through the muscle cells, and it will dilate the coronary arteries, and it will slow the heart rate and increase the myocardial oxygen supply. The anti-anginal drugs and calcium channel blockers have the same mechanism by inhibiting the calcium, and also it will regulate the heart rate of our body. The main drugs used for the myocardial ischemia, that is nothing but the myocardial infarction and heart pains are used as anti-anginal drugs. And the side chains used are nitroglycerin and then which helps in lowering the systemic venous and arterial pressure of our heart. Anti-anginal drugs, the generic and brand names, these are the drugs mainly used in our country and then also in the US for treating the heart related diseases. They are acetobutalol, esmolol and metoprolol, nadolol, propranolol, trimolol. These are the drugs used for the treatment of heart related diseases, that is arrhythmias and cardiac diseases, that is Classification of anti-anginal drugs. Again, the anti-anginal drugs classified based on the side chains only. Based on the side chain, that is the nitrates and then the mononitrate, dinitrate. Based on the side chains only, they are classified into three main types. But first one is organic nitrates. That is again subdivided into amyl nitrite, nitroglycerin, isosorbide dinitrate and then the isosorbide mononitrate. Coming to the class of calcium channel blockers, non-dihydropyridine and dihydropyridine. Pyridine groups are the side chains of the drugs we are designing. In the non-dihydropyridine, it is again classified into verapamil and digitazem. The dihydropyridine, which is classified again into nifedipine and nicardipine and amlodipine. The beta blockers, which is nothing but the calcium channel blockers, it will come under one type of calcium channel blockers, and also it will overlap the anti-anginal drugs. Why? Because it will block the calcium channels and also the beta blocking channels also. The examples of beta blockers include propranolol, adenolol, metoprolol and nadolol and pindolol. Synthesis of nitroglycerin, which is nothing but the anti-anginal drug. The simplest synthesis is we are taking the glycerol and then treating it with hydrogen sulfide. We will be getting the shift and then nitroglycerin will form up. Cardiac glycosides. Cardiac glycosides are nothing but the medicines used for treat the heart failure, which is and also for the certain irregular heartbeats. These are the several classes of drugs used to treat the heart and heart related conditions like arrhythmias and then decreased pace of heart impulse, etc. These medicines are common cause of poisoning also when uptake, when the dosage of the cardiac glycosides are high when prescribed or taken. The class of steroid-like compounds designated cardiac glycosides include well-known drugs, that is nothing but the digoxin and then the ouabain. The ouabain, which is the common cardiac glycoside, and then the digoxin is the common glycoside prescribed by the doctors for some cardiac related diseases like heart failure, in the extreme cases of heart failure. Cardiac glycoside drugs. The cardiac glycoside drugs examples are digoxin, markedly it is called as carpodoxin, and then the lanoxin, digitalis and digoxins. The most common cardiac glycoside prescribed by the doctors is digoxin. They come from the digitalis, that is the foxglove plant. We all know the foxglove plant, which is where they get their name. From the generic name, from the plant name, we are designing the generic name. Other cardiac glycoside includes the ulandrin and bufalin and ouabain. Digoxin is the most commonly prescribed cardiac glycosides because of the side chain and the availability of the foxglove plant in our country. When the cardiac glycoside is prescribed by a doctor, when we are having heart failures, when we are having arrhythmias, that is the irregular heartbeats, unlike the slow heartbeats, when they are too fast, the cardiac glycosides are prescribed. The medicine may also help the people have fewer hospital stays for atrial fibrillation, that is the contraction of the arteries or heart failure. The mechanism of cardiac glycosides include, it will shut down or it will lower the level of sodium, and then the accumulation of intracellular sodium will also be lowered up. It will result in the prevent excretion of, that is exchange, sodium calcium exchange will shut down. So it will increase the intracellular calcium levels, that is the calcium ion levels. So more calcium ions stored in the sarcoplasmic reticulum, that is the cell lining. So more calcium released during the depolarization effects. So results in the force and velocitile contraction of the arteries and veins. This is same for the arteries and veins. Main mechanism is it will either inhibit or it will lower the sodium transfer into the cell. In case it will result in the more of calcium plus ions. So it will result in the contraction, increased force velocity contraction of the atrial and vein. So this is the mechanism of cardioglycosides. The digoxin plays a main role as cardioglycosides. The mechanism of action is depicted in the picture nicely. As we all see, we can the digitalis is acting in the outer layer, inhibiting the calcium ions so that it will increase the Ca++ binding activity. The sources of cardiac glycosides from different plants, these are the sources and these are the glycosides we are synthesizing, we are going to synthesize. Or common glycoside prescribed is digoxin and digitoxin and then the bufotoxin from the Bufo vulgaris, that is the toad-skin. Here we can see the toad-skin, that is nothing but and from also from certain kinds of nut also the glycosides are synthesized, and also from the seeds of Strophanthus and gratis, the Strophanthus G. uvabain, the cardiac glycoside is synthesized. Synthesis of digitoxin. The digitoxin is mainly synthesized from the digitalis, that is geometrically propelled to form the digitoxin. The side effects of cardiac glycosides include, obviously some kind of side effects will be there when we are consuming the heart related drugs, especially acting on the calcium sodium pumps of our heart cells, which include the dizziness, fatigue, headache, anxiety, gastrointestinal upset. This is due to the increased calcium ions present in the arteries, which will result in the high blood pressure of our vein and artery cells, which will in turn supply low blood supply to the gastrointestinal tract, which in turn results in slow digestion. So there will be change in the taste and blurred vision due to some dizziness, or hallucination may also occur because when we are taking high dosage of cardiac glycosides. The severe side effects include the seizures and coma in extreme cases, and heart blocks and atrial and ventricular arrhythmias, which is nothing but irregular heartbeats, and then finally resulting in the sudden cardiac death of a person also. And these are the references. The possible questions from this session is, what are the main cardiac glycosides will be asked, and what are all the vasodilators present, and what are all the synthesis of vasodilators, and then what are the synthesis of cardiac glycosides. We can get questions like this from this session. Thank you.